I'm Adam Darnell, and I'm going to talk about the use of the nasopharyngeal airway. These are the types of equipment that are used to maintain an advanced airway for EMS. Starting off with the J2, the nasopharyngeal airway, which is also known as the MPA, the combi tube, the endotracheal tube, which is more of the hospital setting, and the cricothyroid setup, which is also in the hospital. Why you need to have an airway? Time is critical. 0 to 1 minute, cardiac irritation begins. 0 to 4 minutes, brain damage is possible. 4 to 6 minutes, brain damage is possible but not likely. 6 to 10 minutes, brain damage is very likely, and anything over 10 minutes, brain damage is irreversible. These are the structures of the upper airway, and we're mostly going to go over the nasal pharynx and the nasal air passage, which is just the nose and the upper throat area. Characteristics of breathing: you're also going to be looking for the rate of breaths that they are breathing in. You're going to look for the depth of breath. You're also going to look for the rise and fall of the chest. You're going to look for the visual pattern of the inhalation and exhalation when they're breathing in and breathing out. And everything is driven by a hypoxic drive, which means when someone doesn't have enough oxygen in their system, their body kicks in and tries to get one last breath in. Signs of distress: you're going to have pale and cyanotic skin, which is a bluish tint into the lips, and most likely. You're going to have cool, clammy skin. You're going to be sitting in the tripod position. It means you're going to be hunched over, trying to get the deepest of breath that you can get in. And the last and the fatalist one is you're going to be agonal respirations, which means like it's the death rattle. You're not going to survive from that kind of breathing. This is the respiration rate for an adult, child, and infant. Adults are 12 to 20 respirations per minute. Children are 18 to 30 respirations per minute. And infants are 30 to 60 respirations per minute. And this is just on the way that we perfuse our oxygen in our lungs. The pros and cons of each. The pros of doing a nasopharyngeal airway or an MPA is if the patient has an intact gag reflex, which means if they stick anything down their throat, they're going to involuntarily try to puke or get that out of their mouth. The cons for doing a nasopharyngeal airway is if someone has ever had severe facial trauma at the time of the injury, they have a history of nasal fractures like boxers when they get hit in the nose over and over, or they've had surgery like rhinoplasty on their nose, or if they've had a hard palate issue. And if you have, when you're doing your eval, and if you see cerebral spinal fluid coming from the ears, the nose, or any other part of the head, it's going to be contraindicated to doing. And while you're putting this thing in your nose, in their nose, you may cause bleeding. How to insert and choose the right MPA. First is the sizing. You need to choose the length that is proper for the patient, because each person is different size. The length you choose is you measure from the corner of the nose right here to the corner of the earlobe right there. And the diameter is going to be the size of the patient's pinky finger. And that's so you don't get something that's too big. Try to stick an adult one into a child. When choosing the nostril that you're going to put the MPA into, you always look at the nostril and you see which one is bigger of the two, and you put that one into the larger side. To get the MPA ready, you place lube on the MPA and you put it into the nostril that you're going to, with the bevel facing the septum, which is the middle part of the nose. If the MPA stops, do not force the MPA into the nose anymore. You may do more damage than that. You just simply twist with your fingers the MPA and keep on advancing forward. And when you're done with doing that, you secure the MPA with tape onto the patient's face so it doesn't get dislodged. This is the actual video of a person having an MPA placed in them. Sorry for the language. Watch here.
go. In. Good. It's done. There you go.
Pull it up.
Open it. Wait.
I can see it.
Open it. Can you see it?
Yep.
Yeah. Nice steady. Good work. Good work. Holy fuck. How was that? Fucking hurt.
Well, that's the use of an MPA. Thank you for watching.